Hey everyone, I'm Dr. Joe with Integrative Chiropractic and Extremities, and today I want to come at you guys with some information that Dr. Kyle and I see all day, every day with low back pain patients. Now I want to highlight two separate muscles that are really important. We're not going to dig into a ton of anatomy here, but this is what I want to teach you guys about. We have a muscle here that goes from about our 12th rib and these little arms that are sticking out here all the way out to what we call our ilium, kind of commonly called our hip bone here. And this guy is called the quadratus lumborum. Its job is to bring this hip here up to your ribs. So what that would look like if we were just kind of standing here is kind of just going like this, hiking that hip up. Also, as we walk, it helps your hips to kind of sashay and go back and forth, giving our hips a little bit of movement as we walk. So if this guy gets really tight, it can start to make a side bend towards that side, which is going to compress these facet joints of the spine here. And if I flip our skeleton model around here, we'll also, if you imagine compressing the discs on this side, it's going to kind of push the disc material over to the opposite side and close down on all these holes where the nerves come out. So we don't want this QL muscle to get tight. At the same time, it works in conjunction with your glute med over here, which is a hip and glute muscle that helps to go along the side of the hip joint and prevent you from kind of sticking way out to the side. So classically, we think of people who maybe stand like this with their hip jutted out. This glute med might be a little weak and isn't allowing them to stand upright all the way. So some ways that we can take care of these two muscles. First, usually we want to stretch this QL. Normally it gets really tight and we'll compress on that side, which will almost overstretch the glute med and make it weak. So let's do both of those things. Let's stretch the QL, let's strengthen the glute med, let's lessen your low back pain. So to stretch the QL, what we want to do is find a wall here. We're going to do what's called a skater stretch. I'm going to use the wall for balance, and I'm going to take my hand here and go up and touch the wall while I take my bottom leg, cross it behind, and try to reach into a stretch. I'm pushing this arm up into the wall, pushing this hip away, and taking a good 6 to 8 deep breaths or hold for about 45 seconds to a minute. Nice deep breaths in there. Let those ribs expand, release that QL. The second thing I'm going to do for the glute med is really, really easy. I'm going to stand all the way against the wall here, and I'm going to keep this leg about an inch off the wall and try to slowly raise up as high as I can. Pause and come back down and back out. Pause and back down. You do that about 15 times, not letting your foot kind of drift in one way or out the other. You'll have a nice burn going along that glute med to strengthen it. So we'll open up this QL, we'll have less compression, we'll have easier moving joints, less pressure on our disc, while also strengthening down in the hip, which can be overstretched and a little weak. Again, we see this stuff all the time, we diagnose this stuff all the time, and if you've been having any hip or low back issues, it might be one of these two. I encourage you guys to come on in and see how chiropractic care can help to address these things in the low back and hip. I'm Dr. Joe with Integrative Chiropractic and Extremities, and we'll see you guys in the clinic soon.